everyone. My name is Samara Rezwan. Thank you all for attending. To introduce myself briefly, I am 14 years old and will be going into 10th grade at Bornosis High School in Wisconsin. To touch on a few extracurricular activities I'm involved with in school, I am part of the Student Council leadership team and am the president of 3 organization chapters called Distressed Children and Infants International, which I will talk about later in this presentation. Vision impairment screening and intervention for optical needs, also known as VISION, and health peer advisors and liaisons, also known as Health Pals of Bornosis High School. I am also on my school's varsity tennis team, and in the future I plan on going into the medical field as a physician. So today I will be presenting on the impact of child labor on health, education, and poverty. Child labor is defined by the International Labor Organization as the exploitation of children through any form of work that deprives children of their childhood, interferes with their ability to attend regular school, and is mentally, physically, socially, or morally harmful. From estimates by UNICEF, the International Labor Organization, and the World Bank, there are approximately 168 million children who are involved in child labor. And to put that in perspective, that is about half of the population of the entire United States. Child labor is the exploitation of children, and some children are forced to become involved in slavery or slavery-like practices, sexual exploitation, drug trafficking, and are even forced into the military. Undeniably, child labor is a clear infringement of children's rights and human rights, of course, in many cases, as it denies children of education, safety, as a large number of child laborers are frequently exposed to violence, and of course their childhood, a crucial time for nurture and development. Many child laborers even work 60 to 80 hours a week, and unfortunately, although rates of child labor are decreasing globally, as shown by the figure on the right, progress is not being made quickly enough. Child labor is the most prevalent in countries such as Chad, Bangladesh, and the Democratic Republic of Congo. Child labor laws are unfortunately ignored and difficult to enforce in countries where it is rampant and ingrained in society. On the right is a breakdown of the ages of child laborers globally. According to UNICEF, nearly 70% of these children work in hazardous conditions, including working in mines, working with chemicals and pesticides, or with dangerous machinery. Additionally, the annual death toll of work-related deaths is 2.78 million, and there are approximately 374 injuries and illnesses due to child labor annually. So obviously, child labor is an enormous global health issue. So how does child labor arise, and how do children get involved in child labor? UNICEF explains that child labor is not only a cause, but also a consequence of social inequities reinforced by discrimination. For example, children from indigenous groups or lower castes are more likely to drop out of school to work. Migrant children are also vulnerable to hidden or illicit labor. And additionally, in impoverished families, when work opportunities are poor for adults and adolescent family members, children are the ones the family depends on. And similar to the Industrial Revolution, for example, many children were the ones who provided the income for the family. So all in all, child labor is preventable, not inevitable. Having family in Bangladesh and seeing terrible forms of child exploitation in front of my own eyes, I wanted to do something with the privilege and resources I had to fight child labor. So with my parents' help, I discovered an organization called Distressed Children and Infants International, also known as DCI. DCI is an international organization operating in countries such as Nepal, India, and Bangladesh that protects children's rights. And they do so by lifting children out of the poverty cycle by providing them with free health care, education, and basic necessities. So DCI also inspires youth to take leadership through their high school and university chapters across the US and abroad. DCI has sponsored 1,500 children with basic necessities in healthcare and has also provided 1,114 children with education, provided over 91,000 optometry services, including cataract surgeries, providing glasses, vision screening, and has provided nearly 100,000 vaccines. To contribute to DCI's mission directly, I currently lead a chapter of DCI at my high school where we fundraise money to support DCI's efforts. Our fundraisers this year have been relatively simple, such as donut and candy sales, and through our fundraising and donations, we sponsor impoverished children through our chapter, providing them with education, healthcare, and basic necessities, ensuring that they do not become trapped in the poverty cycle. During our club meetings, we also raise awareness and educate our meeting attendees about child labor and exploitation, in addition to global health issues caused by poverty. And the other organization that prevents child labor that I'm involved with is called Burnosis. Its name in Bengali, when translated, is roughly Begum Rokeya Women and Children Health Development Organization. So this organization is a physical clinic in Bangladesh that provides health and wellness resources and treatment at minimal to no cost. For example, the image on the right with the baby holding its hand out came into the clinic with a burn injury. And Bornosis also offers an educational program for children and adolescents, and it holds health camps that have been focused on primary care, cancer care, and burn prevention and treatment. So I'm a volunteer of Bornosis and spend a great deal of time at the clinic whenever I'm in Bangladesh visiting family. As the Director of Youth Engagement, I have organized and recruited volunteers for its health camps and provided hygiene education to children as a part of Bornosis's education program. And I've also taught the children basic English. So I've also helped the clinic staff with collecting and distributing books and colored pencils, for example, for the children to use in addition to personal hygiene products such as toothbrushes, toothpaste, soaps, and feminine products. So now that I've talked about child labor and some of the work that I've done, I'll talk about what all of us can do to fight child labor. To start, we could learn more about the issue and promote perspectives and information, promoting oppressed voices. And for example, we could sign petitions urging governments and organizations to address child labor more forcefully and effectively. We could also passively support the eradication of child labor by refusing to support or do business with companies that exploit children. For example, we could also avoid fast fashion and buy from brands that are fair trade and sell ethically made products. And if you'd like to get even more involved, you could also become a volunteer for an anti-child labor organization by seeing if they have any fundraisers in your area that you could help out with, or you could reach out to start a chapter at your own school, for example. So thank you all for listening. I hope you were able to learn a little bit about how child labor is a significant global health issue and ways you can join the fight like I did. If you have any questions, please feel free to direct message me on Instagram. And I'd like to acknowledge my family, the Global Health Leaders Conference at Johns Hopkins University, DCI Bornosis, Hannah Choi, Haley Thomas Jordan, Izzy Downey, and the members of my DCI chapter at Wassie High School. And here are my citations.